Hi, everyone. My name is Sandra, and I want to thank you for taking a few minutes of your day to join me in this mindful moment. We're all facing a lot of uncertainty at this time, and while our physical well being is at the top of the priority, we can't neglect our mental wellness. The ability for us to acknowledge and identify with our thoughts and emotions and be more present and focus on the things that we can control. These are the things that are going to help us with the situations that arise and better deal with it and come out more positive and more successful on the other side. So today we're going to spend a few minutes just being present and connecting with our breath. So let's get started. So you're going to find a comfortable position, whether you're seated on the floor, on a chair, lying down, but find your relaxed state. Hands can be in your lap or just along the sides of your body. Just get a last minute movement out of the way. When you're in your comfortable, relaxed state, just gently close your eyes. And let's take a big breath in through the nose. Open the mouth, let that air escape. Do that again. Big breath in. Open the mouth, full exhale. Last one here. Let this be the biggest inhale of your day. Open the mouth, biggest exhale of your day. And let your lips just gently close and begin to breathe in and out through your nose. And just let your breath find its natural rhythm. I'm not trying to change anything about your breath. Just let it be. And as your breath is just flowing, what do you notice about your breath? Is it fast or is it slow? Is it shallow? Is it deep? Where do you feel the breath going in your body? Just in your nose and throat? You feel it down into your chest, maybe into your belly. Feel the belly rise or fall. Feel the air in your nostrils as you inhale and exhale. Is there a sound to your breath? You might have noticed, without trying to change your breath, just bringing some more awareness to it, that your breath is slowed down. Breath is already probably also deepened. Maybe before it was just a chest breath or a throat breath. Now it's reaching down into your belly. So focus on that inhale. Imagine that breath coming into the nose, down the throat, down the chest and lungs into the belly. The belly rises, pushes out. Then as you exhale, the belly softens as the breath moves from the belly to the chest, the throat, the nose, then out. Concentrate on the flow and the movement of the breath and where you feel that breath in your body. You might find that while you're trying to concentrate on your breath, thoughts keep arising, coming into your mind. And that's perfectly normal. We're not trying to remove all thought from our mind. We're trying to give some space to that thought. Then when thoughts come into our mind, they jump from one thought to the next, to the next, to the next. Or we put emotions or stories around thoughts. Or maybe reliving what's happened already in the past, or projecting to what we think is going to or what we want to happen in the future. Trying to be in the present when that thought comes into your mind, not allowing it to swirl and progress, but acknowledging that thought. And then with your next exhale, allowing that thought just to drift off. Then trying to connect back to your breath. We use our breath to try to bring our focus to the present because our breath is always with us, it's always in the present. So anchoring ourselves to our breath allows us to be focused on the here and now. Continue to focus on your breath, your inhales, your exhales. Try to let your thoughts drift off. When thoughts arise, acknowledge them, but come back to your breath. Take your next 3 breaths gently, some movement into the body. Then gently blink your eyes open. I encourage everyone just taking a few minutes of your day, just like we just did. Sit in stillness, connect to the present, connect and engage with your breath. Hands at heart center. I appreciate and thank you for joining me in this practice today. Namaste. And just know that we're in this together and we're here for you.